to a story that took social media by wildfire over the weekend. Hundreds of people caught on video at a jam-packed pool party at the Lake of the Ozarks in Missouri. They're now being asked to self-quarantine. The Kansas City health director made the call today. The health department wants anyone who is at that party or something similar to self-quarantine for 14 days or until they get tested. The county sheriff said in a statement Monday that the lack of social distancing is not a crime and his department had no authority to enforce it. While we don't know if any of the people in that pool were Arkansans, we do know that Lake of the Ozarks is a very popular destination. Today, the governor addressed social distancing. Jay Bird joining us now live with more on this. Jay, how'd Arkansas do over the weekend for the most part?
Well, for the most part, I think Governor Hutchinson was satisfied, but he also did go out of his way to commend Arkansans who are following those social safety guidelines. But he does have a strong message for those who blatantly disregard those guidelines.
I encourage people to put public health above any other consideration in terms of wearing a mask and socially distancing. This is not about politics. It's not about philosophy other than being a good neighbor and being a good citizen.
Governor Hutchinson on the offensive after scenes like this in Missouri made national news over the weekend. But he did praise those who are adhering to safety guidelines here in Arkansas.
People in Arkansas have done the right thing. The vast majority are really paying attention to follow the guidelines and to make sure that they do not contribute to the spread of this virus.
He has said in the past that the state will not shut back down, but in order to move on to the next phase of reopening, the criteria must be met. Dr. Nate Smith emphasizing Arkansans need to do their part in conjunction with the state.
But as I've said before, moving forward, we're going to depend more on public health interventions, testing and contact tracing, but also those individual decisions are going to be what we need more and more to protect ourselves and to protect our communities.
Dr. Smith saying that there should still be concern for a virus, even if the mortality rate is 1%.
1% of the population, if applied to the entire population of Arkansas, that's 30,000 deaths. That's not acceptable.
Really kind of puts it in perspective thinking about it like that. Now, the governor says that the speed in which Arkansas moves into the next phase is very dependent on how Arkansans themselves handle the health part of this pandemic. And then also, too, he did mention hospitalizations were up, and he says that hospitals across the state are ready for any influx. They can handle up to 10,000 beds for those patients should the need arise. He hopes it doesn't get to that point, but if the need arises, the state is ready. Live from the state capitol, Jay Burr, KARK 4 News.